Hey guys, I'm Dr. James Kennedy, Texas Foot and Ankle Centers. I've decided I'm going to start doing a couple of YouTube videos about every 2 weeks, and the reason why is because I really feel like patients, the more they know, the less anxiety they have. You know, you hear of things like white coat syndrome with doctors, and believe it or not, I'm not any different than anybody out there. I might have a little bit more education than the average person, but I really believe that if something's explained right, anybody can actually learn something, no matter how complicated it is. And today we're going to talk about bunions, and we're going to talk about what we call a silver bunionectomy. I love these two foot models because it really demonstrates the aging process in a human body. So if you're looking at these two models, this is your 17-year-old person. This is your 95-year-old nursing home patient. And as you see, they're different, but believe it or not, this is actually the same person. This is how we age, going from a young person to a person that's a little bit more mature in age. So if you look at this foot, you're seeing a person go from a perfectly shaped foot to one with bone spurs here, hammer toes here. Look how this toe starts to curl this way. But believe it or not, you know, when you were young, you had straighter toes. So if you look at this particular foot right here is from a young, healthy person with a perfect looking first metatarsal and big toe joints. So if you look at this, there's no reason why a person shouldn't have a long, happy life. But as we mature in age, this big toe joint starts to become crooked. And what happens right here is you have this bone spur or this ledge on here. And believe it or not, this is called a bunion. So if you look at this toe starts to curl inward towards these other toes like this. And of course you have a bone spur here, and it can rub against this hammer toe, bone spur here, and then you have a bone spur here, and this bone called the metatarsal pushes outward. Well, a lot of my patients don't need to have a large reconstructive surgery on a bunion, and they don't need to have this bone broken. They just need to have this shaved off. So this is called a silver bunionectomy. I do these all the time on patients that aren't the most ambulatory, but they're having a bunion rub on their shoe inside of their foot. So, excuse me, they're having their foot is rubbing inside of the shoe. So what I do, I take a small incision, make a small incision right here, and then I actually open up the skin. Then I open up the capsule, and the capsule actually holds these two bones together. And what you do, you actually move some of that capsule this way and move some of this capsule this way. And then I take a small bone saw, and this bone saw, very simple. You know, you have a button here, and most people, you know, that are outside of the medical community, they don't know what small bone saws look like, and I need to do a video on these just to kind of educate the public on these. But if you look at this is your trigger, okay, and this is your run, and when you go like this, you'll start to have a saw blade, saw motion, sagittal saw. So if you look at this right here, what I go in here and I actually take this bunion, and when I'm going in here just like this, I go in here, remove all that area, okay? And then to smooth it over, pretty simple, you just take this machine off, or the saw off, and then you go in here just like this, you push this on run, and this right here is a super expensive, super fancy Dremel tool that can be autoclaved and sterilized. And you take this, once this bone is shaved off right here, you go in here just like this, and you shave it completely off. And so that's what we call a silver bunionectomy. Now there's many types of bunions. You have an Austin bunion, you have what we call a base procedure, because this is the base of the metatarsal, and that's typical procedures. We have chilectomy procedures, and you know, I can go over some of those in a video, but this is what we call a bunion, and this is a silver bunionectomy when we actually remove that part of the bone. But kind of a neat way to show you and give you an idea on how bunions are removed. Thanks guys for watching. See you later. Bye-bye.